Welcome to Psych 31. This is Introduction to Abnormal Psychology. I'm Mark Stanford, your instructor for this online version of the course. I've been teaching this and other psychology courses for many years, and I've been a treatment provider for a long time as well, treating a whole host of different disorders that we're going to be talking about during this course. And with that background, I will bring some clinical examples to bring alive some of the topics we'll be looking at. The purpose of our course is to provide an overview of mental health problems, and those include anxiety disorders, depression, addiction, psychosis, eating disorders, and mood disorders. Have you ever wondered, for an example, if a friend is bipolar because he's just so moody all the time? Or if a relative is an alcoholic? Or if your friend's sister might have an eating disorder? Have you ever thought about why certain behaviors are considered normal in one culture, but actually a clinical condition needing treatment in another? If so, you're thinking about abnormal psychology. But please note, though, this is not a course about the problems of someone else. Mental illness touches all of us at some time during our lives. And if we are not the ones afflicted, then it will most likely be a family member, a loved one, or even a close friend. The issues of abnormal behavior can be really personally relevant and sometimes emotionally charged. And I want you to know that in this course, we'll explore the problem from an objective and more scientific point of view. And although we have to be dispassionate in our study of the problem, really important that we keep in mind the importance and the intense personal ramifications of what we're studying. So a flow chart to explain the journey that we'll take in Psych 31 is along these lines. During the course, we'll distinguish between pathology versus non-pathological types of behavior. We'll recognize common psychological disorders given their set of symptoms. We'll apply critical thinking to understanding the ethical principles and standards of care. We'll use and be able to explain the various psychological theories of psychological problems, and we'll identify socio-cultural factors in problem identification and diagnoses. So the course will help you to develop critical thinking skills as applied to theories, assessment, and treatments that are relevant for each disorder that we'll be taking a look at. You'll be also encouraged to please consider the role of stigma in mental illness and what we can do to reduce the stigma to increase the access to treatment. So again, welcome to Psych 31. I'm so glad you're taking the course, and I really look forward to working with you soon. Thanks a lot.